So for the precipitating factors, of sickle cell, you need to know that what there are generally different precipitating factors elements. So the first element of the precipitating factor is hypoxia. Is it clear? Now you need to know that what generally hemoglobin, is it clear? Hemoglobin, as we have said initially, is made up of two elements. It is made up of the heme and is made up of the globin constituent. Is it clear? And now you need to know that generally when there is absorption of the oxygen, is it clear? When there is absorption of oxygen, oxygen is going to bind at the level of the heme portion. Is it clear? When there is absorption of the oxygen, it makes the cells to get easily mobile. Is it clear? When there is free absorption of the oxygen, it makes the cell to be easily mobile. Is it clear? Expanded. It makes it to be loose. Is it clear? Because oxygen, as you can just guess, is a volume expander. Oxygen is a volume expander. Is it clear? It is going to expand the volume of the hemoglobin and make the hemoglobin to be easily free. Is it clear? Though inside this globin chain there is an abnormal valine in the position number 6. Are you seeing? So when there is absorption of oxygen, generally oxygen is a volume expander, so it's going to make the hemoglobin to be increased in size and make it to be free and loose. So every time there is oxygen, there is going to be loose/free hemoglobin. Is it clear? The loose/free hemoglobin. But now in the case of hypoxia, is it clear? So in the case of hypoxia, what happens is that there is no oxygen. Is it clear? Oxygen reduces. Since there is no oxygen, the hemoglobin and the globin chain is going to become compacted. Is it clear? It instead now becomes compacted. When it becomes compacted, it is now instead hard. It is no more loose and free, but it is hard and it's no more loose and free, but it is hard and non-flexible and rigid. Is it clear? It is very rigid in this case. So that's why in the case of hypoxemia, the cell is going to become very rigid and they are going to become they are going to lose their motility. Is it clear? And this is the cause now why the cell now will change from their normal biconcave shape. Is it clear? Since the hemoglobin has compacted, the cells are going to change from their normal biconcave shape and they are going to become sickle cell shape. And the sickle cell shape now cells are the one that are non-mobile. They are the ones that are going to cause occlusion. Is it clear? From their high viscosity and low motility. Is it clear? So that is going to result now to the crisis. The second mechanism is dehydration mechanism. Is it clear? The second mechanism is dehydration. Now, to explain dehydration, you need to know that what blood is made up of two major elements. It's made up of the blood cells. Is it clear? So I'll explain dehydration in the back part. So for dehydration, you have to know that what? You have to know that blood is made up of two components. It's made up of the blood cells. Is it clear? And it is made up of blood is made up of two components: the blood cells, and it's also made up of the blood plasma. Is it clear? So those are the two major parts of the blood. And then the blood cells is made up of 45% of the red blood cells. It is made up of majorly the red blood cells. Then made up of the white blood cells, and then you have the platelets. Is it clear? So those are the three major components. So 45% of the blood is the blood cells, while 55% is the plasma. Now, and the major part of the blood cell is going to be by the red blood cells. So now let's say that there is dehydration. So dehydration occurs normally first when there is blood plasma. It prevents that the red blood cells which are in the blood cell component should be viscous. Is it clear? Those abnormal red blood cells, is it clear? It prevents it to be viscous. Now, in the case where the plasma is going to be the case where the plasma is going to be reduced, like in the case of dehydration, what happens is that the red blood cells the blood is going to become highly viscous. Is it clear? You're going to have highly viscous red blood cells. Is it clear? And that highly viscous red blood cells plus dehydration can also cause a change in the shape of the red blood cell to become sickle cell. Is it clear? When it's going to be highly viscous like that, it's going to still pass through a state of hypoxemia, and that hypoxemia is still going to change because of low perfusion of the lungs. It's still going to change the shape of